So, yeah. Well, what I wanted, like I said, it's a tough. Yeah, I remember being a little boy in New York. My little country mother, grew up in the country of South Carolina, and she was born in the 30s. And I remember he was a slow, we had, they had the baby boomers, people in the military, they were coming home getting everybody, getting the wives pregnant, one after another. When my sister was born, the fifth child, I was the first, I was only 5 years old. And I remember one of my brothers had sickle cell, and he used to get sick. And then my mother, we didn't have any money, and she would run out in the street, and she would tell somebody, please help me with my son. Please, please, please help. Please help my son. And I felt, I'll pay you. And I used to say, Mama, we don't have any money. Boy, get in the house. And so I'll pay you. And after I saw that, that motivated me eventually, to come in medicine and said, I'm going to help other people, whether they have money or not. It has nothing to do with how much money they have. They're a human being. In case you need to get one of these. Now, I gave you guys a picture of it over there, and since it was all men there, matter of fact, I had this other little picture that was really, I thank my wife for doing this, because I had this other little picture I gave. She said, no, you got to get something better. And I just want to make sure no little girls that were here or anything like that, because you can see, I do have, you see the private parts of a man right there. And the prostate. Now, do you see the demonstration right there, the normal prostate? Mm-hmm. Then you look to the side, you see the prostate, what happens, it gets enlarged. Most of us, I would say all of us men, are going to have that. It will get enlarged, okay? And then down there, on the bottom, which is the biggest one, you'll see what happens when you have prostate cancer. Now, the prostate gland, most important function is typical of a man. We don't want to have a prostate. Is the production of a fluid that, together with sperm cells that comes from the testicles, which on the bottom there, help make up semen. And the muscles of the prostate also make sure that the semen gets to, get out during ejaculation. So the prostate only has one purpose there. Now, what is the prostate? The prostate gland, as you can see, is below. Look at the picture on the bottom. On the bottom, you see the bladder? Okay? It's below the bladder and is in front of the rectum. Back here. Now, how do we as healthcare providers, doctors, nurses, nurse practitioners, examine the prostate? I don't know if one of you guys will come back as a demonstrator. I have to put my finger in your rear. I have to be down with volunteers. I see everybody. Yeah, I can demonstrate it here. It's all men here, so you have to pull your pants down, bend over. And then I put my finger in, and that's how we examine the prostate. Oh, God, I put my finger back. So y'all okay. Y'all done volunteer. And we do a digital. Yeah, y'all got the picture? All right, so I got the pictures here, and look like we have no volunteers. So I'm just going to let you use your own imagination. As one guy, I asked one guy about doing it one time, and he said, Doc, that's an exit. That's not an entrance. Okay? So since we don't have any volunteers, there's just some data. We look at things in general in medicine based on information we get from studies. And in 2022, they did data. Now, the number one cancer in men is lung cancer. Obviously, smoking. Lung cancer is number one. But number two is prostate cancer. Now, based on the location of it, many men, they're too embarrassed to talk about it. They're too embarrassed to be checked about it. Because he said we got to do a rectal and things like that. So you'd be shocked at how many people that I would say that have prostate cancer, even in this community that we live in. And 27% of prostate, there's a lot of cancer, and recent data has shown that the largest percentage of group of people who are diagnosed with cancer of the prostate is between the age of 65 to 74. But hold on for a minute. 65 to 74. But black men have a higher rate of prostate cancer. The rate is nearly 73% higher. The rate is 73% higher, even for African American men compared to whites. And Jamaican men are even higher. Now, the cause of this higher rate is really, we don't know. It might be environmental, it might be genetic, it might be what we call physiological, but black men's death rate from prostate cancer is twice higher than other races. That's one of the saddest things I've seen. Is black, any person coming in, but it's because, why? Because we're too embarrassed. Because of location. Oh no, you ain't putting your finger down there. Okay, just like the same way y'all. I did that on purpose. Somebody volunteer to come. They don't want to do it in the office either. Okay. Now, what's the symptoms? The majority of people who have prostate cancer have no symptoms when it's early. That's the scary thing about it. With a lot of other cancers, you can find something. Lady might say I have a lump in my breast. Or, with lung cancer, they may be coughing or short of breath or something like that. Or thyroid, you might be able to feel it there. But you feel normal. But when more advanced cancers, they can have changes in the urinary habits, such as slowing of urinary stream. They may go to the bathroom to pass water and it's incomplete. Or they have to get up at night a whole lot. Where the frequency is up, they might have burning. They may have blood in the urine. Or they even may have more advanced disease and have lower back pain. Just because you have those symptoms, the majority of men are going to have those symptoms anyway, because as you get older, your prostate gets enlarged. And you see that part right there saying enlarged prostate? Mm-hmm. So I don't want y'all to run home thinking y'all got prostate cancer, because most men, as we get older, we have to go to the bathroom more at night. Okay? So I don't want y'all to say, I got prostate cancer. But if it chases you to the doctor, then fine. But so I'm not saying just because you have to go at night and have these symptoms that you have prostate cancer. So you might have what we call in medicine benign prostatic hypertrophy, but it's a large prostate. Now, again, we find this by doing a digital rectal exam. In other words, we put our finger and we can find a little nodule. You might find, you see that nodule down there? That thing said tumor on the bottom. You look at the bottom, you see that black dot right there? Mm-hmm. Okay, that's what is a nodule that you feel. You put your finger there and you feel the nodule. Because it should be smooth, but you feel a nodule. And they say, uh-oh. Now, the prostate might be enlarged. But the best thing, the way we make a definitive diagnosis, okay, one of the things we do a routine blood test. And one of the blood tests that we do is called a PSA. Have anybody heard of a PSA? Mm-hmm. Prostate specific antigen? Now, many men who do not have a family history of prostate cancer, or if they're less than 65, they begin cancer screening, PSA, at the age of 50. That's the average risk. But in black men, we use 45 years old. We want to catch it earlier. Because many times, by the time they get to 50, many times, it may be more advanced than we want it to be. So for a black male, 45. you have a family member that have a history of prostate cancer, you may be like your father or something, like your brother or something like that, or even somebody within the family, because genetics may play a role. You are at a high risk population, and you should get your first PSA at age 40. So you don't wait to 50. But if you have it in your family, and out of curiosity, does anybody have you don't have to say who, anybody have a family member who had prostate cancer? All of us there's always, when you see a group, you're going to see at least a hand go up. And if you have that, you should get your PSA at age 40. Prevention, some people say plant-based diet or something like that. How do we make the diagnosis? What we do is that once we do a digital exam, you can stick an ultrasound, like a probe. Where you stick it? Sorry, gentlemen, stick it into the rectum. And it's ultrasound. And we look in there and they see the nodule that y'all see right there. Then what you do at that part is you do biopsies. Now that you take several biopsies, 10, 11, 12, and when the pathologists look at the biopsy, they look at all these different sections, and whichever sections that have the most cancer cells, they use that, maybe one, and you use another one, which might, whoever had the second most, and they assign a number to it. And we call that, this is called a Gleason score. So what that does is tells us how bad, the prognosis, how aggressive the cancer is. How aggressive that is. Then I got a new one I call Epstein score, but I'm not going to get into that. That's very new, but a Gleason score to give us an idea of the prognosis. Now, what's the treatment for prostate cancer? One is surgery. You mean nerve sparing surgery. Right now they're doing things robotically, because there used to be a time when a lot of times after men have prostate cancer, and I'm talking about some of the side effects, in a few minutes. What can happen post-surgically, which is another reason why a lot of men don't want to have it done, because you have to tell them, you should tell them, what could be the side effect, surgery. But now we're using robots now, and what it does is that it goes in there, and it helps you can see better, where the nerves are. Another one is we call cryosurgery, where you use cold, and another one is called radiation therapy. And what you do with the radiation therapy is you use radiation to try to kill the thing there, including the lymph nodes that's surrounded it. Now, that is what you can do with the prostate. Another form of therapy is we call androgen deprivation. In other words, medical treatment, what they do is they can either cut off, we have all men, you cut the nuts off, or you can give them something to suppress their testosterone. Because a lot of them have to feed on that. Now, don't forget, you sit down there talking to a man, and he's like, oh, wait, doc, hold on, this is going a little bit too far now. First of all, you start off, they get mad at you, then you start off, then you're going to put a finger in there, all right? No, you shut up. Oh, no, you let me talk for a minute. No, hold on for a minute. And now, hold on for a minute, okay? Put a finger in there, and now after put a finger in there, you're going to tell me, okay, you stuck me. I don't like needles in the first place. Matter of fact, he talked about it. He didn't like needles. Nobody liked needles. You got me stuck. That didn't get blamed on me, by the way. You got me stuck with a needle. Then after I got stuck with a needle, you sent me to the urologist, and it stuck a probe in my rear end. That you look at him. Ooh, look at that. Stuck a probe. Yeah, you're the one that sent me there. And now you're going to tell me that now you're going to give me something possibly that suppress my testosterone. Man, get out of here. I'm out of here. But I said, well, we can try to do robotics. We can do, surgery, robotic surgery. Was there any complication with that? Well, Okay, robotic surgery is less complication, but any surgery you have, it can end up leading to erectile dysfunction. You know, I might not be able to get an erection. Okay, I'm out of here. That's it. Yeah. I said, well, you can try some Viagra or Cialis. Is that going to work? I said, well, you know, maybe. What you mean, maybe? This is the kind of conversation we have behind closed doors. That's why I'm talking about the prostate. What you mean, maybe? Well, and you can also, if it gets too bad, some people it's bad enough that they have to have chemotherapy. Now, sometimes if you have radiation therapy, if it's localized to the, you know, let's say you might have a person who, you know, is localized, the prognosis is very good. You know, so one thing about prostate cancer, if you catch it early, you know, the prognosis is very, very good. I mean, I don't want to have any kind of cancer at all, but if you're going to have one, that's the one you may want to have. Because, you know, it takes quite a while for you to, you know, for that to spread. And matter of fact, even if it's spread locally to, let's say, to the spine, because let's go to the spine. And you can do what you call target radiation to the spine, but you hope that it doesn't go to other places like the lung and the liver and things like that. So here's the question. Most of those parts, there's different ways you can manage it. You have to talk that over with your doctor. One way you manage it is, some people nowadays, it's so slow growing, some say we're just going to observe. I don't know if I don't feel comfortable with that, but some of you urologists would say, this is observe it, even though it's there. Or if you reach a certain age, okay, then once you get like 70, 75 years old, then many times we can discuss with the doctor, and, you know, we can discuss it and say, well, you want to have a PSA? If I have a person who's sick with a bad disease, like real bad heart disease, or real bad, you know, already have heart disease, or have COPD, or have something else, and I expect for them to live less than 10 years, there's no point in me doing a PSA. I don't, because the cancer itself, the disease itself is going to kill them. You know, whatever other disease. So everybody's different. So you may come in and I might say, okay, with you, I need you to do it, no matter what. And I'm fussing at you about doing it. I may look at him. He's huffing and puffing, bad heart disease. Things is totally out of control. I said, well, you know, I don't think we're going to do it on you, unless you want to. And even if you do want to, we're not going to do anything about it anyway. So everybody's an individual, but the key thing is, if it's caught early, if it gets caught early, it can be treated. And even things like erectile dysfunction could be treated also. Viagra, you know, Cialis, Levitra, and things like that. That doesn't work, you know, you can put in you can put on a pump, a penile pump. Sometimes you can give an injection into the penile area, and the person say, there you go, doc, talking about needles. I already told you I was afraid of needles. So they stop blaming, but I ain't talking about injecting down there. So I told you that already. Yeah. Or implant, I told you, or you can get a pump and just, pump it up. Like, you know how you pump it up, you can do that too. So that's the brief statement I'm making about prostate cancer. I'm going to talk about diabetes in a few minutes also. But before I go into the next topic, this is a very important topic. I'm telling you, it can take your life away. You got family, you got wives, you have kids. You want to live for them. And it can take your life away. And all you had to do was do a PSA. Now also when you get a certain age, you may stop. Like let's say you're 70, 80 years old. You say, well, if you want to do it, you do it. But as you get older, the PSA going to start going up anyway, normally. So, if I have an 80-year-old person, the PSA going to be up. They're going to look it up on the internet and say, oh, I got cancer. Doc, you don't sit there and do nothing? What kind of stuff is, So everybody's an individual. But I'm saying that you should at least get a screening prostate. Now, if you have sex and ejaculate, it can make the PSA go up a little bit. So I always tell this, not all doctors do this, but I know I tell my patients, I tell them, go a few days, like, 5 or 6 days without having sex and ejaculating, because ejaculation, that's what it's part of. It brings up the PSA a little bit. Now you're going to get stuck by that needle again. So go, if you're going to have it done, go 3 days. Go 3, because if you don't, I said, you had sex last night, and you had it done, man, I hate to tell you this, man, it's up a little bit, it's up a little bit. You're going to have to get stuck again, get that PSA again. So what's the normal value? Everybody's different. Normal, this is 0 to 4, but everybody's different. Some people, they're over 2.5, it may be, it's very individualized. It's very individualized. Okay, and the older you get, the more the PSA goes up. So I get a little concerned when the PSA is like 10, but it depends on the person. If I have if a 75 or 80-year-old man or 80-year-old person insists on having the prostate, and it's 8 or 9, 7 or 8, then I said, well, I'll send you to a urologist, but I'm not too sure if they're going to do anything. So it's the individual. Any questions about that, about the prostate? There's a picture you can look at. I gave you guys all the pictures you can take home. That's what the prostate is. Yeah.
You said that most men should get checked at 40.
No, I said, no. The average age for, they tell you you're going to see 50. Black men, 45.
45.
But if you have a strong family history of it, 40.
Right, okay.
See what I mean?
Yeah.
Between 40 and 45, if you have a family history of it.
Right.
Because if you have that, then by the time you get to 50, okay, but if you look up, I look up on the internet, I say 50.
Mm-hmm.
But by the time you get there, yours might be more, it can be more advanced. Right. And we want to get to it because they have different scores. You have different, I won't go too much in detail, but even with the prostate cancer, some are more aggressive than others. And we want to get to it early. But the good thing, no cancer is a good cancer to have, but the prognosis for this cancer is not a death sentence. It's a very, overall, the prognosis is good. But of course, the longer you wait, the more treatment, the more you're going to be going through. But it's usually a good prognosis.
And if say they haven't been checked at all, then you should go get checked.
Absolutely. And they said, like I said, if you have a family history, okay, the black men should be getting checked. If you have a family history, they should get their first one at 40. Okay? The strong genetic, I said genetic might be a role. Otherwise, black men should get their first one at age 45. And then age 45 for black men, if there's a group of white males sitting here and they didn't have a family history, then I say 50. But if somebody come up to me anyway, even they're white or Hispanic, and say, I'm going to get it done at 45, I say, okay, fine. You're not going to get an argument with me about that. But I get more strict about it, as you get, your category.
Right.
So how often should you be checked? Once a year?
Well, again, that is very, and that's a great question, and that's a very, very good question. And somebody's running that. What I mean is, it depends on your level of your PSA. Let's say your PSA is up a little bit. Then I may say, just do it again in 6 months. Then somebody else, I may say, maybe a year. So a lot of it is based on your PSA. And somebody else, I might say, 2 years. So you have to discuss that with your doctor. It's very individualized. So let's say normal PSA is 0 to 4, right? And your PSA turns out to be like 4.1. Then I'm gonna tell you, I'm gonna say, Lamar, we need you back here in 6 months to do yours. But on the other hand, if his turn out, and yours is like 2 or 3, I say, maybe a year 2. but it should be checked. It's very individualized. Yeah.
Is there anything like nutrition wise that we can help slow it down or help prevent it evolving and getting bigger?
Well, some people, nutritional. Some people, say like a plant-based diet. Mostly dealing with plants, and there are herbal supplements that people take like saw palmetto, things like that.
Yeah, I think.
Yeah, and I think that's pretty good. The plant, for nutrition, plant-based. Meaning, vegetables, more vegetables. Because our diet, may be a lot of meat and this and that, and so a predominantly vegetable diet might be preventive.
Is it true that like if you eat like red berries, blueberries, like stuff like that, I can't pronounce all of the stuff that has in it.
Yeah.
It helps out
Oh,
with
yeah.
everything.
Oh yeah, no doubt about it. Our diet too is pretty bad. So a plant-based diet is really important. But you're right, that's a good point. And things like that, fruit and vegetables.
The berries have a high antioxidants in it.
Yeah, antioxidants.
Yeah, that's what I was trying to
Most
say.
of the berries.
Yeah, definitely.
Yeah.
Plant and fruits.
I take also myself. I take a lot of herbs. I haven't taken any medicine up to 30 years. I mean, as far as prescriptions, because I haven't had a need for it, and you just kind of proactively do things.
Yeah,
And
that's
I come from that direction more so than that. But one of the things that I've read about, and the studies on it that I've read about, is turmeric and boswellia. Those two together actually fight cancer throughout the whole body.
yeah.
Boswellia is frankincense. It's a biblical. It's a name.
Right.
Frankincense.
Yeah.
So just stuff like that is what I've done over the years, and keep myself in there. Plus, of course, my prayers and praying on everything I do. and one of the things that you said earlier about discernment, just to say this to all of us, the Holy Spirit checks us on our diets. He'll check us on whatever we're doing, but we got to listen. Hear and follow, because he'll tell you to cut the sugar. He'll cut this because he knows our bodies. And he knows how to critique and put us in a space where he's telling us that tailor-made plan for you and me. He's going to show us that what he knows is going to save, because we're the temple of the Holy Spirit. He's going to help us keep that temple going because he has need of us. That's right. Finishing our purpose. So I'm just.
No, that's true. Herbal stuff is really important. Most medicine comes from the plant. If you look at it, and that's a totally different. Maybe next year I'll talk about it. We're not designed to eat meat. Meat is not good for us, but we eat it. I mean, you look at the Bible in Genesis. Vegetables. There's as one guy said. There's another saying that food be your medicine, and medicine be your food. So you eat the right food. That is no doubt very, very helpful. And I do believe in herbal stuff. I take about 30 or 40 herbal pills a day. And the only thing I have in my, I don't medicine, I'm just taking, I have glaucoma, so I take medicine for that. That's helped out. So I do believe in herbal supplements. But as a doctor, I have to go by what's considered standard. Otherwise, theoretically, I can be sued.
Right.
So I can't look at somebody and say, and you're right, I'm glad you're taking saw palmetto, I'm glad you're taking turmeric, but what, did you do this and do that? So the medical field don't have that, huh?
I also do the PSA side.
Yeah, but you still, no matter what though, I don't care if you're doing vegetables, saw palmetto, everything else, get your PSA.
I do that kind of stuff personally because I want to know what's going on with me, so I know what to pray about.
Amen.
I know that, and I go against whatever's trying to attack this temple because it belongs to the Holy Spirit.
Right.
That's just the way I see things.
You don't eat no meats. Yeah. My brother now, he's much older now. He said, Mom, I'm not going to eat it. He's a little boy. I'm not going to eat any meat. That's it. I'm through with meat and things like that. She said, we having, he said, he said, what we having for dinner tonight? He said, pork chop. He said, well, I want some of that. He said, what we gonna have tomorrow? He said, chicken. He said, I thought you were vegetarian. He said, I don't want. He said, I'm not gonna eat any bacon. And he said, I'm gonna continue pork chop, bacon, chicken, and things like that. But otherwise, I don't want. He was just a little boy. Otherwise, I don't want any meat. Any other questions? Purpose, erectile dysfunction, there's so many different things involved with that. Matter of fact, I'm going to be talking about diabetes in a minute, and that could be an example for that. But when it comes down to erections, it depends on the blood supply there. There's a vascular supply there. There's an artery that comes on your penis. Okay, and that could be that. The artery. You also have neurologic. You have nerves there. And you get neuropathy. Like for instance, diabetics they get neuropathy and they can have erectile dysfunction. You also have, outside of that, you also have things like, as we age, you can get more erectile dysfunction, and you may need more foreplay or more stimulation than in that. So that can lead to it. Another form of erectile dysfunction is what you call delayed ejaculation or unable to ejaculate. That could be a form of erectile dysfunction, and it might be related to the muscles down there in that area. You might hear about Kegel exercises that may or may not help, or things like that. It may be due to the medication you might be taking, and that could be a factor. Or another 6 factor I can give for erectile. I can go all day with this. A 6 factor might be mental. You might be all stressed out, or you might be having some issues with your wife or your girlfriend or whatever, and that can also lead to erectile dysfunction. And that kind of stuff. A lot of people don't realize that. Stress is a major factor there. Like you and the ladies not getting, y'all not getting along, that can lead to some erectile dysfunction. Or another thing that can lead to erectile dysfunction is what we call performance anxiety. When you sit up there saying to yourself, am I gonna, am I gonna fail in doing this? Am I gonna be able to get this up or not tonight? Or am I gonna be able to satisfy her or not? Or you know what I mean? Like, man, it's gonna get up. And if it doesn't get up, how long is it gonna stay up? Or I'm gonna be able to satisfy her. Or another form of erectile dysfunction may be related. I'm giving you 9. I can go on. Maybe if you drink too much alcohol, or too much liquor, you might be taking too much. Too many, certain drugs. The alcohol or street drugs. Now they got all kind of stuff out there in the street now. When I was growing up, you just go there and get weed and just go get a thing of weed and that's it. Now they're putting fentanyl on that. It's killing people. And part of that. And back in the day, since we talk about, I was on a basketball team in college, and we used to, sometimes we used to smoke before a game. I was telling you, one of the treatments, I think you cut it back on now.
Right.
You have to be careful with testosterone because one of the treatments for prostate is to lower the testosterone. So you have guys, man, I'm going to get there to the gym, 65, 70 years old. Matter of fact, man, I can't do what I used to do. That's why I'm limping here now. I went to the gym yesterday, did a little weights, and now I'm limping here. I had to borrow TC's cane. So you can't, I can barely walk now, because I worked out too hard yesterday at the gym. But what I'm saying is that lowering testosterone would be a factor too. But don't take any testosterone without, I used to say a lot of those guys, don't talk unless you talk to your doctor about it. Don't take it. And there's different forms of testosterone you can take too. That's another topic.
And there's some herbal things that I take that naturally help my body to generate its own, it's not testosterone.
Yeah, I do that too.
Do that kind of stuff.
Yeah. Me too. I take it herbally. Yep. Anybody else have any questions about prostate?
You mentioned
Section. So you got burning, or you might got a hold of the wrong person. And you burn with discharge. You don't tell me you got prostate cancer. That's what we did last night.
Oh, that mercy.
Now they use that for an excuse. They will use that for an excuse. They look it up. They come in like that. Yeah, Dr. Thompson told me I have prostate cancer. I suggest you don't try that with your wife or your girlfriend. She ain't gonna believe that. Yeah, don't try that. You got more sense than that. And you look at the history of the person. I mean, somebody told me I've been smoking for 25 years and they coughing up blood or even doing a lot of coughing in general. I smoke a pack a day 25 years and they coughing, even coughing consistently. It might not be cancer, but I'm short of breath. Well, it might be COPD, it might be something else. But I'm like, it's in the back of my mind. I don't like to see blood. Yeah.
No.
If it's coming from the rectum, I like to see, it doesn't have to be cancer. It could be a hemorrhoid, it could be a polyp, it could be something different. Anybody else have any comment? Any other question about the prostate? I'm going to take 5 minutes to mention something about diabetes real quick, because somebody requested that. Any other question about the prostate?
When it comes to the surgery, if somebody needs surgery.
Surgery of prostate? Yeah.
Is it done in front, or how does that happen?
Well, like I said, you may want to discuss that with the doctor, you know, because some of them is like that. I'm not a urologist, so I don't keep up to date with type, because now they're even doing robotic surgery. And you have to, you know, because they want to try to spare the nerves.
Right.
Because if you hit those nerves, that can lead to erectile dysfunction. So that's one reason they're doing it. So I'm not up to date with that because I know about it, but I can't be specific about it.
Right.
Yeah. Okay. Any other? But please get your PSA. Get your PSA. Prostatic specific antigen. PSA. That's really, really good. And like I said, you know, it can save your life. You have a good prognosis. It's not pleasant, but good prognosis. Okay? Just 1 or 2 questions, you know, 1 or 2 things about diabetes, and I can't, do I have any time to do that? Do I have any time to do that? Diabetes? I'll leave it up to you guys.
Right. You
Am
on?
I going to speak? So I'll just go over general about diabetes. How many people have heard of a hemoglobin A1C? Or glycosylated hemoglobin? Y'all heard of that? Now, it used to be a time when patients will come in. I've been in medicine long enough to know that. I mean, I've been doing this like for 45 years, and it used to be a time when they fooled the doctor, you know, say, I'm going to eat real good for 2 or 3 days. That way when I get my sugar, my fasting blood sugar, is going to look good. But you can't try that trick anymore. It don't work. That don't work. Now, Now, that don't work anymore. I still have people trying to get away with that. Yeah, doctor, look at my sugar today, it's 75. Yeah, but you didn't even go with A1C is way up higher than that. There's something, and you now only have a few minutes. You have something in your red blood cells. You have red blood cells that carry oxygen to the rest of your body. And one of the things is hemoglobin. But not only does it carry oxygen, it also carries glucose or hemoglobin. So hemoglobin A1C will give us an idea of what your blood sugar has been running over the past 2 to 3 months. Maybe 3 months. And that's how long red cells last. And then they die and you get new ones. 3 months. Now normal hemoglobin A1C is less than 5.7. If you are normal is less than 5, in other words, it's 4 to 5.6. If your value is 5.7 to 6.4, we call that pre-diabetes. I mean, you're heading toward diabetes. It's, you know, you still can correct it, and that's usually with the diet. You know, you drink too many sodas or eat too many sweets. That's my weakness, and things like that. Or if you're diabetic, then it's like 6.5 or above. There's the screening. And again, you can repeat that. You know, with 6.5, I may have you come back and say, Lamar, you've been eating too much sugar, man. Or 6.6, okay, I'll tell you that right now. I'm not going to, you know, you got to do better. I'll be fussing at you about that. Stop eating those cakes and doing that, you know. And I'm gonna repeat it in 3 months and see if it's coming down. So if it's over 6 months, if it's consistently elevated, then you're classified as diabetic. And then, then based on the level of that, you go into treatments, you're gonna use pills or you're gonna use insulin, whatever. We have to be careful about diabetes because you know what? I'm just gonna give you the complications. Okay.
Yeah, I was telling some of the guys we had a little break. That happened to me when I'm a diabetic. And the doctor had me on taking shots, and I stopped eating pasta. I stopped eating a lot of fried food. I quit eating a lot of sweets like cake, ice cream, and I started doing so good. And I was taking shots. He told me, Walt said, "You're doing excellent." He said, "You're doing so good to where you don't have to take shots anymore. You keep doing as good as you're doing. After a while, you won't even be a diabetic."
Right, so that's why I was just giving an example. I see you on like I guess I was using him maybe because he's the closest one to me. Yeah. I'm gonna use something next. That's what I say, going back.
You were looking at this. That's
No,
all right.
I'm going him next.
Take shots.
I had that too.
Yeah.
Now I got that.
But sometimes, let me tell you something. You're talking about erectile dysfunction. A lot of times, let me tell you the complications of diabetes. One of them is you can have an effect on your heart and your blood vessels. Yeah. And that only means heart attacks. Yeah. But, you see a lot of people have heart attacks or strokes. And that might be an early sign. They may have what you call hardening of the arteries. Erectile dysfunction. Because, again, the arteries are in the penis. Blood flow. Okay? Smoking would double the risk of that if you smoke, of complication. Kidney disease is something that you can get from diabetes. Even to the point where you get bad enough, you can get dialysis. That's why you have to make sure your doctor check your, how much protein is leaking in the kidneys. Because it shouldn't be leaking protein like that. And kidney damage. You can also get a neuropathy from diabetes, a complication. What do you mean neuropathy? Well, neuropathy might be, you might have some numbness or tingling or burning of your certain parts. Your hand or feet or something like that. And also, men, erectile dysfunction. That's part of a neuropathy because those sugars mess up the nerves. I'm making it simplistically, but those sugars mess up the nerves. And you might have, a lot of diabetics have erectile dysfunction. If you're a diabetic, it is mandatory. It can have an effect on your eyes. Make sure, don't just go get, I got my glasses checked. No, that's cool, but you got to check your retina. You can get a retinopathy. You call that diabetic, what can that lead to? What can that lead to? No, not glaucoma. No, I wish it was. I got glaucoma. I don't have diabetes. What's the retinopathy, diabetic retinopathy lead to? Blindness. And it'll come back. Yeah, so you should continue to get it done too, by the way. Once you get your retina checked. Okay, I'm gonna emphasize that. Well, I got my eyes checked, doc, I'm blind. I got glaucoma. I don't have, I got my new glasses on. My glasses are all the same. I'm bragging. And I'm looking at you, and I'm saying, Ron, look, man, you get your retina checked? No, I don't know about all that. I just know I got my eyes checked. Well, you want your retina? You want your retina checked. Also, it can lead to skin problems where you can get ulcers. Like if you're a diabetic, make sure you get your feet checked real good because if you have these diabetic ulcers, you know what that can lead to eventually? That's right. Amputation. And we hope we can do it below the knee amputation. Now you say, maybe you see this is the knee joint, right? Maybe this is the knee joint, right in here, right? Okay. We're hoping we can do it below the knee amputation. Now, why do you think we want to do a below the knee amputation? We'd rather do that. We don't want to do any amputation. You want to do it below because you'd rather have a prosthesis put here so you still have the flexibility of the knee. And then you can almost walk around. But if you wait too long, or something like, you might end up getting above the knee. And now you just have to put a rod there. Now the person is walking. They're probably walking like me, but no, I don't have an amputation. I just hurt my knee yesterday, but then is this a rod? Okay? Another thing about it, about diabetes and other complications, is mental health. diabetes is depressive. It makes a lot of people get depressed. Why? Because they can't function the way they used to function. Again, guys have erectile dysfunction. They're going blind if they don't get themselves checked properly, or they're doing certain things, and they can't eat certain foods. Okay, because you know, diet is extremely important for diabetes. By far, remember I just said that medicine be your food, and that food be your medicine. That it can be cured with that. They're gonna tell you that 100%. They say, here, take a pill, take insulin, do this. But if somebody, you want it, you know, the proper eating, the proper herbal supplement, things like that, that's very important. And another thing is what you call, and this kind of stuff that's kept me up at night over the years as a doctor. If I get a call, you can go to your call. Have you guys ever heard of ketoacidosis? Mm-hmm. That's life-threatening. In other words, if you ever send me up at ICU in the hospital, if it's not a person having a heart attack or something real bad like that, if they're in DKA, what we call diabetic ketoacidosis, the ER doctor called me, it's 1 or 2 in the morning, okay? He said, hey, this person is DKA, I ain't getting any sleep that night. I'm just getting dressed and telling my wife, you know, I'm on my way. And then the emergency room doctor would get things started. And then so I get them transported to ICU. Then I had to end up many times transporting them. Then you have to put them on the insulin drip. You know, it's scary. That's one of the two things that get me nervous. Not too much get me nervous in medicine, but that ketoacidosis get me a little nervous. And but if I saw somebody coming in, I worked in the emergency room. I was in Mississippi one time. The guy got cut or shot. You know, he got cut, and his whole gut was hanging out. Well, that was no. You know, as long as he was there, I mean, that didn't get me nervous at all. You know, just push it back in, and did some other antibiotics, and he was bleeding and everything. The family's all upset, and they worried. You know, that's no problem. But some things get me. If I get nervous, then you should need to get nervous. Diabetic ketoacidosis. I won't say nervous. I can still function, but I'm saying, you know what I'm saying? I'm like, oh my gosh. I'm like, man, I'm not going like this, oh Lord, you got DKA. No, I mean, it's not like that. I mean, you know, I'm just like, I got, you know, I'll be there in a minute. You know, I'll be there, I'm on my way. I'm getting dressed, and I'm on my way, and I'll be there. Okay, and if you don't be there in about 15 minutes to the ER doctor, because he or she has to take care of it until I get there. And hey man, you coming or not? Man, I'm right outside the door. So so it gets you a little bit more tense. But those are complications of diabetes. So diabetes is also get your hemoglobin A1C checked. And if it's too high, just try with a diet. Depending on the level, you know, my weakness is sweets. And too much sugar is not, and that's my weakness in all honesty. And I can bring up, but if you stop your diet and you change, that can get better. Amen. Any other questions about diabetes or? I mean, I can't be specific. Everybody's different. And you know, of course, you hear this. Just one other comment I want to make real quick. Have you guys ever heard of the medicine called Ozempic? Mm-hmm. Okay, Ozempic is something you take once a week. Very expensive. It costs about $1,400 a month. You know, thing. Well, a lot of people now using. You're gonna hear about this. It's called Wegovy. You ever heard of that? Mm-hmm. Now you know pharmaceuticals gonna make money. It's the same thing. Now all of a sudden you may see somebody who might be as big as me. Now and then all of a sudden you might see them a month or two later, and they're like that. You know. So you know, so it makes you lose weight real quick. You know, because that's one of the side effects they saw from Ozempic. You know, once a week. You know, you get that Ozempic, and you know once a week. And it helped them lose weight, and of course they're going to capitalize on that, where now you're going to see people using that as a diabetic thing, as a diabetic medication. And they lose weight real quick. And what they don't know is, number one, you have to stay on it. Number two, you don't know how long the pharmaceutical is going to let you keep taking it. And number three, when you get off it, guess what happens? It comes right back. And many times come back a little bit more. I'm just throwing that in because that's you know, they don't call it Ozempic, we call it Wegovy. I'm not coming down on it, but I'm just saying you're going to start seeing a lot of people who you saw was pretty obese, you're going to start seeing them real thin because that's what they're pushing. Now, I agree that, you know, people have heart disease and you say, well, I'm giving it to them, but the best thing for you is not a pill or a medicine. The best thing for you, if possible, is number 1, number 2, and number 3, diet. Diet. That's 1, 2, and 3. Even more than exercise is important, but everybody can't exercise as well. 1, 2, and 3, proper diet. Not saying, give me a shot of this.
That's what I did. I had to change the way I eat, change what I eat. That told me the best exercise you can do is walking. And I walk.
Yeah.
I do a lot of walking. But I had to change what I was eating. Ice cream, I love. Fried chicken, fried pork chops, I love. Now, if I eat fried chicken, I might eat a piece of fried chicken once a month.
You want to exercise by, you don't try to get like 100, ideally about 30 minutes a day or 150 minutes a week. So you want to divide, you aim, don't start off for 150 minutes. You haven't been exercising, build up to it. And then you might split it up. You might say, I might do, 30 a day, or I might do, you can break up to 150 minutes into 7 days or 5 days, whatever days you want. I might do a whole lot in one day and this day, but eventually add up to that. But diet number 1 and exercise number 2.
People that got diabetes, they can change a lot themselves. If they just stop changing what they eat.
Because the
It got a
food,
lot to do with what you eat.
absolutely. That's why I said the
Everything
food.
to do with what you eat.
Let your food be your medicine, and the medicine be your food. Your best medicine is food.
That's right.
Food. And I gotta be careful with that, because I heard some people say, "Yeah, he told me I can go ahead and eat." I didn't say that. People usually shocked when people blame on me. Like I told a guy one time, you need to drink more. I come back and he's all liquored up, and then his wife bring me in and said, "Well, he the one that told me that." I didn't tell you to drink more liquor. I said drink. I said, okay, I meant water. Yeah, but he was drinking liquor. Well, he know better than that, but they like to blame us.
Yeah.
That goes back to the topic. Who's talking and who's listening? See what I'm saying?
There you go. You're right.
And saying people want to do what they want to do. I want to ask you, is bread bad for you, right? Too much bread.
Too much bread.
Yeah.
Yeah.
I try to,
Too much bread.
my wife family, they eat bread with a sandwich. They got a sandwich, but they got a slice of bread. It's like, I'm like, girl, you eat muffins and you eat bread or tater chips with everything.
Right.
Oh, that changes the sugar.
Yeah.
But and you're gonna eat it, anything white, like white flour. So if you're gonna have it, wheat bread, of course, it'd be better.
That's all I eat. Wheat.
Yeah. But she still even though it's wheat bread, she still eat too much.
Right.
Yeah, it's too much.
So actually, you asked the question and you gave the answer at the same time. Yeah. You gave the answer.
I eat Ezekiel bread. I buy it from the Amish people, and they make it fresh. I don't buy it from the frozen store, but Ezekiel things, and it's made from the natural
Don't have
grains.
no yeast in it.
Yeah, and it's also made with live cultures. It's not made from the dead food.
Right. Anything dead, theoretically, that we eat is dead is not good. To be honest with you, when we eat it, anything dead is not good. Like any dead animal. But if you cut back anything, like anything else, you gotta cut back on it, because man is not designed to eat meat. Animals are. Some animals are, and those animals are. Again, that's a different one. Like dogs and cats. Don't notice how they eat like that. They eat their food when you see them like that, and they lick up their water. I mean, those are like meat eaters, and they don't live as long, and they sleep a lot even at night, as opposed to vegetarian animals, like they live longer, they chew, like that. They come up with diabetes and all other kinds of diseases. I'm not saying that's the only cause, but I'm saying food. Your medicine should be your food, the proper food. Right.
Right.
Any other comments or questions about prostate or diabetes? I know that's just a little general thing about diabetes. I mean, and prostate. I mean, of course, it's much more extensive than that. But that's, give you guys,
Have you heard about fufu?
you know,
African fufu.
yeah.
Not good.
Okay, I'll let you be the expert on that.
Well, natural, as opposed to stuff with preservatives and things like that. Cooking from fresh, is that, or portion sizes?
Yeah, preservatives is not good, can preserve the food. If you saw what was going on now, you guys would be in a state of shock.
Yeah.
If you know what's going on.
I read labels all the
Yeah,
time.
yeah, you will be stunned.
You say
Genetic manufacturing, I mean, the insecticides and stuff they're putting on the foods and things, and you can see what's going on with the environment, with with global warming, and you see how hurricane just hit us a little bit. They hit us here. I mean, man is self-destructing with the food and the environment. And then now we get to the point where we buy water. I got you kicked. I wish I would come home and tell my mother, can we go to the store and buy water? Boy, get that out that faucet. She might, out the faucet. When I was coming up. But right now, people buying water. I never, we never heard of buying water.
That faucet water, they got so much stuff in it. You could run out your faucet on a white cloth, and you'll see black stuff on the white cloth. So you can't drink that faucet water. You tell you
Right.
that now.
And you also notice that we have a little meat that with the refrigerator when I was, doing the thing. And any form of meat we had in the house, we had, we was out for 4.5 days, and any form we had to throw out because it was stink. Mm-hmm. But you take vegetables, they were okay. And that's the same thing happened when we put it in our body. Oh, Casey, go ahead.
Sea moss, what is it good for? Because I keep seeing that sea moss. I know Dr. Shelby, that his name. He's doing that.
I'm not too sure. I mean, anybody have an answer for that?
I see a lot on it, but I haven't read up on it.
I really read up on that.
It's kind of something that came out.
Yeah.
It's being advertised a lot, though.
I do have a question about all this stuff you talk about, all the pills and all this stuff. You hear I'm not picking on you because you're a doctor. I'm just saying, but you hear the doctor say, this is good for you this year. Next year, they'll go, this is bad for you. Quit taking this and take that. And then they'll be, don't take this, take that.
Right.
I mean, what is it because of the research? They find something that is like another thing, the side effects of pills, what gets me. Mm-hmm. I got a headache, so you give me something for a headache, then you say it causes runny nose, diarrhea, and your eyes gonna pop out of your head. I'd rather have a headache.
Yeah, right. Exactly.
That's my problem. By the grace of God, I don't take medicine. My blood pressure, by the grace of God, even I weigh 300-something pounds, and my blood pressure is great. It blows the Dr. Mind, but it's by the grace of God. There's nothing.
Yeah.
Okay.
No doubt.
But what I'm just saying, they put me on cholesterol, and I was laying in the bed, and I went to get up, and my arm was like this, and I went to move, and my arm wouldn't fold, and so I found it by the grace of God. I got him to go. I went to the pharmacy, and the pharmacy told me, she said, I'm going to tell you something, but you go to your doctor still. She said, it's the medicine. And it will make you stiff. And once it locked, they said it's almost impossible to get it unlocked. That's what they said. So I called my doctor. You know what they had the nerve to tell me? Have you always been like that? I said, I just was in your office 2 weeks ago. Did you see my arm like this? So my thing is it the research you are finding that the side effects is causing different things? That's why they keep switching.
Hey, can you cut it off?
We just
I'll give you a real
one
answer.
second. This is third report.
Is off.
Yeah, it's third report.
Okay, you can keep it in.
No. Just the research. How many times that they switch on the same subject, and he mentioned cholesterol, and we know about eggs and everything. How I think there's more research now that is saying that it's okay to eat it. Now, last year, the year before, it wasn't. The other year is the white, is the yolk, is the white, is the yolk, and now it's good. Now we thought this cholesterol was the bad one. Now this one is so. What keeping the side effect in perspective, could you address that a little bit? Thank you.